are here live at ASAPS 2019 in New Orleans, and I'm here with Dr. Huettner, and we're going to ask you a little bit of questions about ASAPS. So, how's it been so far for you?
It's been an incredible experience. It is every year. I love coming to the ASAPS meeting. It's a wonderful meeting. A lot of national and international colleagues here to speak on the podium with the latest and greatest about plastic surgery, but also with a big focus, especially this year, on patient safety.
Okay. Is there anything that you're going to be brought to your practice, whether it's a certain technology or certain device, or even just something that you've learned, anything that you might be applying to the practice?
There's always something that can be learned in these meetings. I mean, like I said, there are international and national colleagues speaking on the topics and showing real results, showing real patients, and there's always something that I take back to my patient population and apply just to improve the technique, to improve certain ways of doing things, but also just the whole patient safety issue, talking about it, how to better approach patients, how to better talk about certain topics. It's really good to mingle and to talk to other colleagues about that, how we can better connect with our patient base.
So when you say patient safety, kind of expand on that a little bit. What are some of the things that you guys can do to better patient safety?
There's a big focus on, of course, this year the big topic that everybody's talking about is breast implant-associated ALCL.
Okay.
And the device choice of it, textured versus smooth implants, and is there still a role for that, as well as the science behind it. So it's really good that we talk about. Or the other example would be safe buttock augmentation with fat grafting to the buttock. It has a pretty high reported mortality rate in 1 in 3,000. So we do have to make our patients aware of it, and we have to listen to the task force and implement the techniques of like I do, just injecting superficially for a BBL or gluteal fat grafting, and it's important that we bring this up in the and talk with our patients about it who will undergo the surgery, and to really counsel them about that.
Okay. So when you say, when you warn some of your patients about this, do they ever take those warnings and say, you know what, actually, I'm going to say no?
Yes, some patients do. And that is part of the informative consent that we do with the patient. It's not just a piece of paper that they're signing. It's actually the conversation we have with the patient about the risks, the indications, risks, benefits, and potential complications.
Okay.
And it's one of the things that needs to be talked about is a certain mortality rate with certain procedures that we're doing, and the patient then can make the decision to undergo the procedure or not to undergo the procedure. It's their choice.
And speaking of safety, backtracking a little bit to the ALCL regulations recently, what are your thoughts on that?
Well, it's a very important topic. I utilize only smooth implants in my practice.
Okay.
I don't use textured implants. I have not used textured implants in the cosmetic or in the reconstructive arena. And I talk to my patients about that. There were great panels during the meeting here talking about that. There's a certain role in some providers' hands for still textured implants because of the position of the implant, especially in the reconstructive arena, and what the result that we want to achieve for the patient.
Okay.
And so there's always a plus and a minus to everything.
Yeah.
My biggest concern is about patient safety, and in Australia, the risk reported is 1 in 80,000.
Wow.
So, of course, it is more likely probably for somebody to get hit by lightning or as they're bringing the examples, or to get hit by traffic, or to have anything appearing like that. And it's important we talk to the patients about that. But in general, I choose to not expose my patients to the risk at all. I think it is a still evolving topic that we just over the last couple years learned more about more intensively. And it is a recognized cancer entity by the National Cancer Institute. So we do have to make our patients aware of it and talk about it and counsel them about it. And then every provider, needs to do whatever they feel comfortable in their hand offering to their patients, and let the patients, make the choice. And it is a personal choice that I'm making, and I'm not saying that all textured implants are, bad. By far not. There are different grades of texturing and different kinds. So we have to be careful and make patients aware there are different types of implants that can be used and that are providers using. And not every implant is the same. But that comes back to our preoperative consent that we basically have with the patient, taking the time to talk to them preoperatively about the choices that they're having, plus and minuses, indications, contraindications, and really to present them with all the options that we offer as provider. But the patient is ultimately the one making the choice what they want to proceed with and not.
That's great. Do you think that, first question actually, was this a choice that you had made later by only offering the smooth implants, or did you choose to take the textured implants out of your practice because of the risks, or were you only always offering smooth?
I was always offering smooth implants, so it's not an adjustment I made based on the reports of ALCL. I did not do that. I always offered smooth implants because they work really well in my hands and the work I do with them. And so that choice I didn't make based on the reports that we have.
Okay. And do you think that the regulations that are started in France, do you think that it's going to make, I hear that doctors are increasingly taking out of the practice, or like you do, at least increasing awareness of the patients to make sure that they understand the risks. Do you think that eventually the regulations will come to the US to where the textured implants are taken out of the game completely?
Well, when we make, always all, inclusive or exclusive statements, we have to be really careful because taking an entire entity of implants out of the market, there are so many different indications, and like I said, not every textured implant is the same. There are different grades of texturing, and there are, still indications in certain providers' hands. We can only offer what works well in our hands, to utilize them. So, and as long as we are honest about the patient, and to say, okay, we need to talk about the risk, like we talk about potential fat embolism with a BBL, and we have to talk about, if we use a textured device, about the potential risk, of implant-associated, ALCL. But again, 1 in 80,000 or even higher numbers than that, the risk compared to other things that we're doing is, relatively low. So I think that we have to be careful saying, will we get rid of all textured implants, or will we not, with an all-inclusive or exclusive statements? I think the research is still out there. I think the verdict is still out there, and we have to just raise patient awareness and adjust what we're doing based on the findings that we will gather.
Okay. Thanks for sharing about that. Let's move to a lighter note now. Is there anything exciting going on with you, the practice, anything that you want to share with people?
Yes, so actually I'm really excited about that. We just moved office location in New York, and my new office location is on Park Avenue, 568.
It's still in Manhattan though, right?
Oh, yes.
Okay.
So
don't have to change the name or anything.
No, 568 Park Avenue at the corner of 63rd and Park. So
Okay.
I'm really excited. Joining that office space with one of my prestige colleagues, and so it's a beautiful space, and we're just really excited about it.
Awesome. How far along are you guys? Have you fully moved over to the new office?
Yes, we're
Okay.
fully moved over. We have 4 consultation and treatment rooms available.
Wow.
We have a fully accredited surgical suite in the office, so to provide, be able to offer all office-based surgery, office-based surgeries. So that's wonderful. So fully accredited operating room, a lot of additional devices to offer, as well as basically being able to offer the whole package. And so I'm really excited about this.
Oh, so it's not just a move. You've full on done
Yes.
a revamp. That's great.
Yes.
That's awesome.
Yes.
Well,
So
great to hear about that. Thanks for sharing your time. Thanks for
of
sharing your
course,
knowledge
my
and thanks for
pleasure.
sharing
Thank
a
you
little
so
bit about
much.
Appreciate it.
Okay, thank you.